Welcome to today's session on the evidence pyramid, which is part of evidence-based medicine. For the majority of you, this may be the first time you've heard of these terms, but don't worry. As undergraduates in the health sciences program, which can include, nursing, medicine, dentistry, by the end of this session, you'll be well familiar with what is evidence-based. So here's the agenda for our seminar today. We'll look at what is evidence-based medicine, the evidence pyramid, looking at the levels of evidence, and then going into the different study types, the criticism and alternatives. When we think about evidence-based, what we're referring to is research that is supported by a large amount of scientific evidence. In your readings, you may come across different abbreviations, such as EBM, evidence-based medicine, or EBP, evidence-based practice, or EBCP, evidence-based clinical practice, or EBHC, evidence-based healthcare. So according to a 2021 study, the most common abbreviation found in the literature is EBM followed by EBP, as they were most often used interchangeably. So we'll use evidence-based medicine. And what that is the most up-to-date, scientifically proven results in order to make health-related decisions, such as the pros and cons of a certain treatment. But it also considers the patient's values. So both a patient and a doctor could ask any one of the following questions, like what is the cause of the condition? What is the natural course of the disease if left untreated? What will change because of the treatment? How many other people have the same condition? And how do other people cope with it? So when it comes to finding research on how to treat a patient, it can be an overwhelming task for a health practitioner because there's a ton of research available. For example, in the biomedical field alone, there are more than 1 million papers submitted into the PubMed database every year, and that's about 2 papers per minute. So health practitioners will often look at the evidence pyramid as a way of finding the best available evidence among the research. Now, there are 5 levels of evidence. Starting from the bottom, we have low validity but high bias. And as you work up in the pyramid, you will find that there is a high validity and less bias. So at the bottom, we have expert opinion. Moving up, we have case series or case control studies. Next, we have cohort studies, then randomized controlled trial, and then finally systematic reviews and meta-analysis. So let's dive in to the bottom of the pyramid where it starts off with expert opinion. And this is research written by an expert. There is no study design and it's more prone to bias. Moving up, we have case-controlled case studies or case series report. And basically, these studies help identify variables that might predict a condition. The drawback of this is that there is a small number of participants. Next, we have cohort studies or longitudinal studies, and basically they follow a large group of people with similar demographics or characteristics such as age or race. And these studies go over an extended period of time to see how exposures affect their outcomes. And cohort studies can either be prospectively or retrospectively. Then we have randomized control trials, which basically measure the effectiveness of a new treatment. And there are two groups, one with treatment and the other without. This is a way to look at the cause and effect relationship between an intervention and outcome. So there is a randomization process that does make the study less biased. Also, in a double-blinded trial, it's when neither the researcher nor the patient know what treatment is being received. Finally, at the top of the evidence pyramid is systematic reviews, which has the strongest and highest quality of validity because or less biased because they compare results of studies side by side. Although the evidence pyramid has been used since the mid-1990s, there are some flaws with it. For example, it can be problematic, especially in nursing research articles, where about 40% of them do not describe their trial design. As well, um, because of this, the pyramid does not give the full picture. However, there is a new pyramid that was introduced by Morad in 2016, and it basically gives a new way of looking at the quality, which varies in primary studies. So while the old evidence pyramid is a good way of thinking about evidence for best practice into medical care, it's not perfect. And it's just these two models just another way for you to think about what's out there. Thanks for coming to this session. Hopefully you will find it helpful in the way of your thinking about evidence. If you have any questions, please feel free to reach out to me.